Hello, thank you everybody for joining me again at Dark and Twisted. I am Brandy, and today I would like to talk about my last fusion, which is actually my third fusion of L5S1. So, to start, I would like to backtrack a little bit leading up to this surgery. In previous videos, I had mentioned what I needed to do to at least tie me over till surgery was a must. So between getting the nerve end burnings, epidurals, any type of medication possible, this was all going to lead to the fact that I needed another spine fusion. Already having two under my belt, I was not ready for how awful this surgery was on my body. So anybody out there that has issues with L5S1 or any vertebrae in that area, the one thing that I'm sure you all have learned is how it affects your waist down and how much this affects your lower half of your body. And I like to inform people of how every single vertebrae and nerve connected to your spinal cord operates another part of your body. So anything at L5, 4, 3, 2, 1, S1, SI, all of those are connected to anything that operates your body waist down. So my early 20s, doctors were addressing my lower back issues. In 2005, I did move down to Las Vegas. I continued to get treated there and get my nerves burnt and epidural blocks and whatever they could offer me. That continued. It continued after I gave birth to my daughter in 2008. 2000, let's fast forward a little bit to 2012, 2013, 14, 15. Slowly, I was feeling the effects of my lower spine and what was doing to my body. 2016, that's when my health really went downhill. And that's because the stress of the issues at L5S1 were starting to really impact me at a young age. I think it was 35 at that time. And so it was really hard for me to accept what was going on. So with that being said, other things started happening to make me realize how that part of your spine really controls your lower half of your body. My right hip, now because my spine is crooked, one leg is longer. I've always had issues with my right hip hurting. It is confirmed I do have bursitis in that hip, but doctors also needed to let me know that a lot of that pain in my hip is probably coming from my spinal cord. So 2016, my body took, like I said, a real dip. I got my first kidney stone. That was awful. Because I am in a lot of pain back there, I didn't know what was going on. I just figured, hey, my back hurts, my lower back always hurts, what's new? Well, probably for like a good 5-6 weeks, I was walking around with a kidney stone. It was awful. And obviously, one morning I woke up thinking I was dying, and I got to the hospital and found out I had a kidney stone. The doctors looked at me and said, well, how do you not feel that? I said, sir, I feel it, but I feel a lot of things down there because my back's screwed up. So it's kind of hard to figure out what is what. After that kidney stone, I continued to get fevers. I was told I had viral infections. In those few years too, because I was getting all these other issues, I took time off going to my spinal doctor. Because this is my life story, I get sick of going to the doctor. I get sick of dealing with doctors. 100% I do. And I'm sure you all do too. It's draining. It's exhausting. It's like, what am I going to go there and tell? What is he going to say? My back screwed up? Like, we already know that. Like, what are you going to do for me? You can't give me a new spinal cord, so what's new? But I wasn't understanding what was really going on inside me. And it was end of 2017, beginning of 2018 is when the pain got really bad. And I was losing feeling in my legs. I was losing feeling in my feet. I was not sleeping. And during this time of my life, I was not taking any long-acting pain medication. I was not taking any medication to sleep. I go through these spurts also of medication is good, medication is bad, is it in my head? Should I get off of these meds? Are they really working? Are they making me worse? I mean, you get fed so many different things. It's like you don't know what you're doing. And personally, I wanted to figure out, like, is this pain real or not? So it was a really hard time in my life because I have a young daughter. I'm a single mother trying to work in Las Vegas full time. And meanwhile, my health is just going down fast. So early 2018, actually it was in March, I got back in to see my spine doctor. I was really more prepared for him to tell me I needed a new hip. I really thought this was my bursitis, my hip is done, it's time for a new hip. Here we are finally. I wasn't ready for him to tell me that there was even more things wrong with me. So after getting CT scans, MRIs, and after my spine doctor yelling at me that I'm supposed to come in every year, and I hadn't seen him in 2 years, it was confirmed that I now had pars defect, spondylosis spondylolisthesis, which had been present since early 1999, 2000 technically. But the pars defect was new. And I also found out that one disc was completely gone. So literally bone on bone, there's nothing there for cushion. So pars defect is pretty serious. What that means is that is it's a fracture in your spine. In other words, I was walking around with a broken spinal cord. In the x-ray, you can see a chunk of my bone is just missing. The best way to show you hands, let's say this is my pelvis area and spinal cord, this is the top, is actually off like that. So I had lost about 1.5 inches in height. The pain in my legs, when I eventually would fall asleep at night, I would wake up feeling like my feet were almost curled like this. Felt like I'd been walking on rocks all night. Like there was nothing wrong with my feet because of course I went to a foot doctor in between to see what was wrong. It was confirmed nothing was wrong. Just all this pain was coming from that L5-S1 area. And I was becoming paralyzed. And I think that is the scariest thing to ever go through, is to wake up one morning and to not feel your legs and to not feel your feet. I was miserable. So when I seen doctor, it was actually March 17th of 2018. He confirmed surgery was a must. You know, he said, Brandy, I've known you for 12 years. Your spine has deteriorated on its own. Time for surgery. So it was hard to accept that because I knew the surgery was going to be serious. I knew the surgery was going to be hard. And I knew that there was no other options. And I didn't want to live in a wheelchair. I didn't want to feel the pain that I was feeling. I wanted my legs back. I wanted to be able to sleep at night. So I had to get ready for surgery, which of course takes time. We were looking at summer. I also needed to be prepared with the fact that I could no longer pick up my daughter. I knew I was going to be off work, if not never work again. The surgery is serious, and I think if you have had this surgery, you understand what I'm saying. You know, me having 2 surgeries already, I was not ready for how brutal this surgery really is. So I'm going to talk a little bit more in detail of just little situations that I personally went through. I know a lot of you are scared that you're about to go down this road. So let's talk about it. Preparing for the surgery, you know, of course, walkers, canes, wheelchairs, lots of bed rest. You need someone to take care of you. You could barely even go to the bathroom by yourself. So usually with the surgery, they go through the front and they go through the back of you. My doctor could not go through the front because of my pelvic bone is tilted up. He said it's too much in the way, which I was thrilled because I did not want another scar in my belly. So I'm like, can we just keep it on my back, please? So surgery was around, I think, 5-6 hours long. When I woke up from surgery, I could feel my legs. Another thing that I noticed is for about 2 years living in extreme pain, I was sweating all the time. Doctors blamed it on hormones. No, it had nothing to do with hormones. That was my body's way of telling me something is really wrong. Immediately waking up, my hands were dry and I could feel my feet. And I said that. And I remember the nurse was laughing at me because she was like, "You're so happy." Like, well, A, I'm alive, and B, I can feel my feet. What an amazing feeling. So I had a positive attitude from the moment that I woke up, which when you're going down this road, you need to keep that attitude that you can do this, because this surgery can take you down mentally and obviously physically. Of course, so personally, I'm allergic to medication. I'm allergic to Dilaudid. So I had to make sure to tell them I can't have Dilaudid. So of course I woke up with the morphine drip. I also advised the doctor I did not want a fentanyl patch. You know, at that time, I was not taking long-acting pain meds anyway, so I was confident that when they did give me one, it was going to do the job. I'm not a fan of morphine. Personally, I don't like being so high. I don't like thinking that I don't like the thoughts of I don't know what's going on. I like to know what's going on. Morphine to me takes you to a whole different level of, I don't even know how to really describe it. It's just, I don't like being on that drug. Does it help? Of course it helps. But personally, it makes me itch. I don't like how I'm like in and out of consciousness. Like I was like eating my food on that night one, and I was like passing out while I was eating. It's scary. So day 1, morphine. Day 2, morphine. That evening, doctor came in to check on me. I asked him to please remove the morphine. He thought I was crazy. I said, listen, I don't want this. I don't like it. I got out of my bed last night. I thought I was normal. I'm trying to pull cords out of the wall. I'm trying to take myself to the bathroom. It was a nightmare. And yeah, just please take it out. So he's like, well, what are you going to do for pain? I'm like, well, can you just give me some pain medication? And I actually brought some marijuana edibles with me, and I'm going to treat my pain with cannabis. He looked at me. He thought I was crazy, but he's like, yes, let's give it a shot. So I removed the morphine, continued taking my edibles. I was in the hospital till day 5. I actually wanted to get out on 4th of July, but that I take that back. I wanted to get out 4th of July. He said, it was a possibility. So I was released that evening. He thought I was crazy because I didn't want any harder drugs. He was concerned that I actually was in too much pain and I didn't realize I was in too much pain. To backtrack just a little bit, when you have this surgery, they also put a tube in you, which gives you a second incision back there. And that tube is to drain the blood out, and it's also used for some other reasons. All I know is that when I would move, I had it looked like a blood grenade in my hand and it was always in my way. So before you get released, they have to take the tube out. Doctor asked me if I would like the morphine back. I insisted that I didn't. I was tough. I didn't need it. Biggest mistake of my life. If they ask you for the morphine, you take that morphine. When they removed that tube out of me, first of all, I didn't realize how deep it was inside of me. Second of all, I actually fainted from the pain. Scary, incredibly scary. I thought I could handle that. Clearly I couldn't. I came to a couple minutes later. Doctor looked at me and said, next time, take the morphine. So that's my advice. I know there's other drugs possibly out there. This is, of course, I'm not a doctor. This is my personal experience. Take the pain medication. So coming out of the hospital, yeah, get ready for reality to hit. Once the drugs wore off and the pain was real, it was a big reality check for me. Using a walker, a wheelchair, I could barely walk. Getting out of bed was the hardest thing for me to do. Other people having to shower me, help me in and out of the bathroom. I mean, I'm 37 years old. I feel like I'm 100 years old. And it was a big reality check. So any of you going through this experience, stay strong. Be thankful. I hope this surgery solved some problems for you. Did it solve my problems? Yes and no. This surgery is serious. Having rods put back in your body, that's a whole nother level of pain. This area is where you bend. I can't bend over anymore. I can't arch my back anymore. Sleeping is always an issue. I now have restless leg syndrome. It's hard for me to lay on my right side. The right hip is still an issue. Doctors don't want to give me a new hip because now I'm 39. Is it going to help me? They don't think it really is going to help me. So I'm still battling a lot of different things, but I'm not dripped in sweat anymore. My body isn't in shock. It isn't in so much pain. I'm able to control the pain with help of medication, stretching, physical therapy. I also have done cupping on my back, lots of massages, hot tubs, heating pads, all of the above. Definitely stay strong and try to smile through all the ridiculous times. I'll be 3 years post-op in about, 5 months from now. Do I regret the surgery? No, it was a must. I needed to do it. I believe if I would have never had the surgery, I would have been in a wheelchair full time. There's no way I could physically move on with my life. So I thank you all for joining me. I hope you will join me back for some more conversations about spinal issues, and toodaloo for now. Have a good day. Thank you all for watching my dark and twisted tales. If you like what you are hearing and you would like to know more, please subscribe to my channel. You can also follow me on Facebook and on Instagram. Toodles!